41.8% of Australians aged 14 years and over have used illicit drugs in their lifetime. So let's take a look at your brain on cocaine. So what is cocaine and where is it sourced from? Cocaine is an alkaloid extracted from the leaves of the erythroxylon coca plant, native to the Andes. The cocaine itself is a hydrochloride salt in a white crystalline powder that uses snort through the nostrils. Research from the Australian Drug Foundation reveals that 8.1% of individuals aged 14 years and older have admitted to using cocaine one or more times in their life, whilst 2.1% admit to using it in the last 12 months. However, it is important to keep in mind that given this research was reliant upon surveys, some individuals may not have been honest, and therefore the usage rates may be greater than this. So why do people use cocaine? The sought-after effects users seek to obtain include euphoria, increased energy, mood elevation, a boost in self-confidence, increased talkativeness, and reduced fatigue. But how are these effects induced? Let's take a look at the biological action of cocaine upon the brain. Presynaptic neurons in the brain release dopamine, a neurotransmitter associated with pleasure and happiness. The dopamine interacts with complementary receptors on the postsynaptic neuron's membrane to induce these effects. Normally, shortly after release, the dopamine is reabsorbed by uptake regions in the presynaptic neurons. However, when an individual has used cocaine, these uptake regions are inhibited by the cocaine molecules, leading to a buildup of dopamine molecules in the synaptic cleft. Initially, whilst the dopamine is floating freely, users experience the buzz. But the result is overstimulation of these pleasure pathway nerves in the brain. With continued use, the dopamine remains free in ever-increasing amounts as successive nervous stimuli continue to arrive, releasing dopamine. However, the prolonged use of cocaine makes the brain adapt to it, causing the overall synthesis of dopamine by the neurons to decrease. Users feel buzzed for about 10 minutes, but then this subsides. Between cocaine doses, or when the use of cocaine is interrupted, the drug user experiences the polar opposite of pleasure. Users may experience loss of libido, restlessness, nervousness, sleeplessness, aggression, suspicion and paranoia, hallucinations, and delusional thoughts. These behavioural effects are some of the many consequences of using cocaine. For a 10-minute buzz, it's just not worth it.